Good afternoon, everyone. My name is Gergő Szabó. My PhD thesis is Improving Outcomes in Acute Life-Threatening Emergencies. As you heard, I work as an emergency specialist in a country hospital in Székesfehérvár and in 2 different ambulance services. Thereby, my vision is implementing new approaches and making unproven conventional treatments obsolete by providing scientific evidence that could improve outcomes in emergency care. To achieve this, the mission to provide scientific evidence to prove the above and implement scientific-based patient care on a wider scale in my department and hospital. So, the 2 topics what I am working on is the bedside ultrasound, the PoCUS one, and the DKA. So let me focus on first that one. The title is The Effects of Point of Care Ultrasound, the abbreviation is PoCUS, use on the improvement of clinical outcomes in patients with acute dyspnoea. That will be a systematic review and the meta-analysis. The problem that the hospitalization in condition with acute dyspnoea is often means a high mortality rate in a 30-day term. It can be between 10 or 15%. And to make a correct diagnosis is very often difficult, which can delay the treatment. The conventional approaches like auscultation, percussion, chest CT, chest X-ray, or an ultrasound made by a radiologic expert is often time-consuming and not achievable immediately in the emergency room, and it can lengthen the hospitalization. We know that PoCUS can enhance early treatment, but evidence is uncertain. PoCUS is already affordable in the majority of the hospitals in our country and also in the world, so this topic is up to date. Thereby, my aim is that our study will assess the efficacy of PoCUS versus the mentioned conventional approach or length of hospitalization in patients admitted with acute dyspnoea. The question that does PoCUS usage reduce length of hospitalization in acute dyspnoetic patients compared to conventional modalities? So the patients are anyone who's got an acute onset dyspnoea. The intervention arm will be the PoCUS, the comparator, the conventional methods. The primary outcome is the length of hospitalization, and there are some secondary outcomes, as you see, like mortality, time to diagnosis, time to appropriate treatment, and readmission rate. So the hypothesis that PoCUS shortens the length of hospitalization, time to diagnosis, time to treatment, and mortality in patients with acute dyspnoea, and the clinical implication that in this way we can reduce the time to appropriate intervention and hospital stay. We made with the search key systematic search with more than 11,000 results, and after title and abstract selection we could reduce it 34, and we've already made the full text selection with marked pair with the 0.59 kappa, and the final we found 18 articles, and we have already begun the data collection from this pool. My second project focuses on, again, an emergency condition. The title is The Effects of 0.9% saline versus balanced crystalloid infusion on the resolution of diabetic ketoacidosis in adults. That will be, again, a systematic review and a meta-analysis. The problem that DKA is responsible for more than 500,000 hospital days per year in the USA. With a high mortality rate, especially when occurs major complications. So without adequate and in time immediate treatment it can mean between 15 and 50%. But with the fluid resuscitation, with adequate fluid resuscitation, we can reduce this number because that is the cornerstone of the early management. We know from the guidelines that saline or balanced electrolyte solution called BES are the best ones. Saline, it contains more chloride ion than the balanced electrolyte solution, but do not contain any potassium. In a large volume, it can cause hyperchloremic metabolic acidosis, which can worsen the inflammatory response, and it can lead to impaired renal function. In contrast, balanced electrolyte solutions contains potassium, so the electrolyte levels are more physiological. It can improve acid-base balance and may lead to better outcomes. But the disadvantage is that in some cases it can cause hyperkalemia. So my aim is to answer the question that does balanced crystalloid infusion compared to saline administration shorten the time to resolution of diabetic ketoacidosis adults. You see my PICO. Patients the population will be adult patients with diabetic ketoacidosis. The imperator arm will be the infusion of balanced crystalloid infusion. Is the balanced electrolyte solution is the same. The comparator will be the saline. The primary outcome is time to resolution of DKA, and there are again some secondary outcomes. So the hypothesis that balanced electrolyte solution compared to saline administration shortens the time to resolution of DKA in diabetic ketoacidosis in adult patients. So, if it's true, we can say that this type of infusion can cause faster resolution of diabetic ketoacidosis, which is an important clinical implication. So, with the search key, the mentioned databases, we made a systematic search with a number of 7,000 articles, and we can work with this pool with my pair. So to summarize it, both of my topic focus on emergency situations. The first one is a bedside ultrasound modality, and the second one is an emergency endocrinology or metabolic disorder. I want to thank you for your attention with a quote from my professor. Diagnosis can wait, but cells cannot. Thank you very much.
Come on, Gergő, explain that quote.
It depends on how we define the diagnosis, and it depends on which part of the medicine do we. So in my case, of course, it can wait a bit, but not too much.
Time to resolution diabetic ketoacidosis. Okay. What is your definition, and what is the definition of the articles? Maybe I have problem if the definitions are not similar as for feasibility of this meta-analysis.
Yes, you are absolutely right. There's a discrepancy between the definition of time to resolution of DK in the USA and in the UK. I try to short sum up. So there are three main points. The first be the pH above the 3.0, so near to the physiological level. The second one, stop and resolve the ketosis, so reduce the ketonemia or ketonuria. And the third one, the base excess or the level of bicarbonate should be above a correct number. It depends on the definitions in the meta-analysis, and then there are, a fourth other, but not both the definitions mentioned it, the anion gap. It's a calculation with the different level of ions. So in the meta-analysis, we will use the most wider definition. So we try to incorporate most studies, and we wrote to this Prospero that if we will have enough data, we will do a subgroup analysis based on the different type of definitions.